I'm not a doctor, but I can offer some general information on remedies that may help with male sexual reluctance and erectile dysfunction. It's important to note that these remedies may not work for everyone, and if you're experiencing persistent difficulties, it's best to consult with a healthcare professional who can provide personalized advice. Here are a few simple remedies that some individuals have found helpful. Maintain a healthy lifestyle. Regular exercise, a balanced diet, and sufficient sleep can contribute to overall sexual health. Engaging in physical activity, such as jogging or strength training, may enhance blood flow and improve erectile function. Manage stress. Stress and anxiety can negatively impact sexual performance. Find healthy ways to cope with stress, such as practicing relaxation techniques, e.g., deep breathing, meditation, yoga, engaging in hobbies, or seeking support from a therapist or counselor. Avoid smoking and excessive alcohol consumption. Smoking can damage blood vessels and affect circulation, while excessive alcohol consumption can impair sexual function. Quitting smoking and limiting alcohol intake may improve erectile function. Communicate with your partner. Open and honest communication about sexual desires, concerns, and expectations can help reduce performance anxiety and build intimacy. Exploring different techniques and focusing on mutual pleasure may also alleviate pressure and increase comfort. Try relaxation techniques. Techniques like pelvic floor exercises, also known as Kegel exercises, can help strengthen the muscles involved in sexual function. These exercises involve contracting and relaxing the muscles used to control urination. Consult with a healthcare professional for guidance on performing them correctly. Consider herbal supplements. Some herbal supplements, such as ginseng, horny goatweed, and L-arginine, have been used traditionally to improve sexual function. However, scientific evidence supporting their effectiveness is limited, and they may interact with medications or have potential side effects. Consult with a healthcare professional before trying any supplements. Seek professional help. If your sexual reluctance or erectile dysfunction persists or causes significant distress, it's important to consult with a healthcare professional who specializes in sexual health. They can assess your condition, provide accurate diagnosis, and offer appropriate treatment options tailored to your specific needs. Remember, everyone's situation is unique, and what works for one person may not work for another. Consulting with a healthcare professional is crucial to address any underlying medical conditions and receive appropriate guidance.